is what we now call root canal treatment. So that is probably what you know better than endodontics. And root canals are basically whenever a cavity gets so deep in your tooth that it starts giving you a lot of pain. So this pain will keep you up at night. It will be sensitive, like tooth will be sensitive to any kind of heat, cold, anything that really touches it. And those are telltale signs that that cavity has gone so deep that it's now touching the nerve in that tooth. And if it gets to that point and it starts to cause swelling in your mouth, that is when we start to do a root canal. And root canal, we go in there and we literally clean out the nerve in that tooth, clean out all the bacteria, clean out all the decay that's there, and be able to give you what we call a dead tooth, quote unquote. So that tooth is still in your mouth, but you don't have any feeling with it anymore just because the nerve is out. And it's all filled in with a material that kind of replaces the nerve in that tooth. So once everything's cleaned out, we have to replace what used to be there, like that space. So we put a material in there to fill that space in, and then on top we put a filling, and then on top of that we definitely put a crown on that tooth. Because once there's no more like nerve supply or blood supply to that tooth anymore, that tooth will become very brittle. And you'll notice that, once that tooth is prone to breaking a lot more than if it was any other tooth in your mouth. So that's why I really recommend putting a crown on that tooth after. If it's not done properly, then you will have, continuous pain on that tooth. You will notice that that pain never really went away, or that swelling is still present. And you will have to probably go back in and redo that root canal. So properly do it, we have to make sure it's cleaned out properly. We take like x-rays throughout the whole procedure and make sure we get all the way to like the end of that root. We clean it continuously throughout the whole procedure, and then after that, every time you come in for visits, we also take an x-rays, making sure that it is healing the way it needs to heal and that it's not really acting up or doing anything out of the norm that it shouldn't be doing.